Welcome back. In this video, we'll talk about myasthenia gravis. This condition is caused by autoantibodies against the postsynaptic acetylcholine receptors. The synapse is the area between the nerves and the muscles. In the postsynaptic area, which is the muscle, we see these acetylcholine receptors. If we want to move a certain muscle, the nerve will release acetylcholine, and they will stimulate the acetylcholine receptors in the muscle, and the muscle will contract. In myasthenia gravis, the autoantibodies will destroy the muscle acetylcholine receptors, so the nerves will have very hard time stimulating the muscle to contract. This presents as easy fatigue, and the patient sometimes have full strength during the very first movement, which means if you ask them to push you, for example, they will do that very strongly, but quickly after they will feel weak and tired. So the muscles can contract, but they cannot sustain the contraction. This mainly presents as diplopia in the eyes and ptosis, and it can also affect the respiratory muscles. The esophagus also has peristalsis muscles, and they can be affected, and this presents as dysphagia. And the oral muscles can also be affected, and this presents as difficulty chewing. To think of the symptoms, think of any muscle that you cannot use for a long time. So the hallmark of myasthenia gravis is worsening symptoms with muscle use. The condition is very commonly associated with thymoma and thymic disorders. So if diagnosed, the patient has to screen the thymus. Physostigmine cures all symptoms of myasthenia gravis momentarily. It acts very quickly, but it also disappears very quickly. We use it to diagnose myasthenia gravis. If the patient feels fatigued and tired, and after they take physostigmine they feel refreshed and energized, this is a very strong indication of myasthenia gravis. But this is an old test, and nowadays we don't use it as much. And the first line and treatment of choice is pyridostigmine. And here's a small quiz. In myasthenia gravis, what happened to the muscle reflexes? Do they increase or decrease, or stay the same? Like we said, in myasthenia gravis, the muscle has full power for the very first contraction, so they don't have any abnormalities with the reflexes. Alright guys, that's all I have, and thank you so much for watching.